Joining us now is Dr. Robert Murphy. He is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Morning.
It sounds like this research could help alleviate the vaccine problem. Do you feel like it's solid, or is it still too sketchy?
No, it's not sketchy, but it's too early. This is a laboratory experiment. They engineered the virus. They put those mutations in that they find in South Africa, and then they tested it in the laboratory, and it appeared to work. Great. So for variants, it's great, and but it's way too soon.
They also some studies saying that the Pfizer and Moderna vaccines are really doing well against these new variants.
Yeah, that is very encouraging. But again, it's laboratory work. However, it's much more encouraging than what we heard about in South Africa when the AstraZeneca vaccine went down there. It did so poorly that they actually stopped it.
This is something we've talked about before. The CDC some suggest it needs to establish air guidelines. We used to talk about droplets of air settling in the air in an enclosed room. Is that still the thinking, that that's a problem? Because we're getting ready, well, we are opening up restaurants even more than we had before.
Well, we know in enclosed spaces, the more enclosed you are, if it's poorly ventilated, that the virus can spread. That's well known. And so what the people are asking for is the CDC to come up with an actual guideline. Like, what are we supposed to do? How much air exchange is supposed to take place? How many people in a certain size volume room should there be optimally? So they're just looking for guidance to go forward.
Also, word that the military service members, a lot of reports of them postponing or refusing to take the vaccine. What would the impact of that be?
Yeah, no, that's very strange. But it actually mirrors what's going on in the general population. So in these military studies, between 30 and 70% of the military people are wanting to take the vaccine. They're all being offered it. In the Navy, it's much higher. Because they know on a confined ship like a boat that it spreads really fast, and there's some very bad cases and experiences in the Navy. So the Navy is a different kind of situation. But if you put all the military numbers together, it kind of mirrors what's going on in the community, where only about 50 to 60% of people say they're going to take the vaccine.
All right, let's get to viewer questions. There is much in the news about the UK variant. A look at the UK data shows a sharp decline in cases and deaths over the last 3 to 4 weeks. Do you know what the UK did to effectively battle this variant? Can we say that their vaccination plan was a major factor?
Well, there's really two things going on in the UK. I don't think people here realize what a crisis it is in the United Kingdom right now. It is really serious. It's much more serious than what's going on here. So they had a very strict mitigation plan, and it was across the entire country, and there was no ifs, ands, or buts about it. The other thing is they really loosened up the vaccine distribution rules and use rules. So they allowed people to get one vaccine for your first dose, another vaccine for the second dose. They spread the dosing apart by up to 3 months. They did all sorts of stuff, and it apparently has worked. So that's good for them.
All right, next question. My husband and I were hospitalized in the beginning of October for COVID. My antibody test was positive on January 20th. Wondering if I should get another test done before getting the vaccine, or just wait a month or so longer.
Yeah, no, this question brings up a lot of important points. The antibody test doesn't have anything to do with whether you should take the vaccine or whether the vaccine even works, right? So these people got COVID about 3 months ago. They should take the vaccine now. It doesn't matter at all what the antibody said. And they don't need to test for the antibody now or after they take the vaccine.
All right, let's take a look at the next question. Seniors in high school are starting to think about end of the year festivities. What is your outlook about proms and graduation ceremonies? What about summer weddings?
As been stated by President Biden, we're supposed to have 600 million doses available cumulatively by July 31st. Then you have to distribute those vaccines to basically this phase 2 group, the general population. That's going to take months. So what does that mean for proms and graduation? It means that probably it's not going to be ready. it won't be safe to do those things unless there's like all outdoors and everybody's 6 feet apart and so forth. For the summer, it's going to be really a mixed bag because we're not going to be able to get up to herd immunity by the end of the summer.
Womp,
Sorry.
womp. Well, yeah, you know,
Yeah.
what can you do? It's sad. Sad for the kids. Anyway, we'll
Thanks,
have.
Sunshine.
Yeah.
Debbie Downer here, you know. But
We want to talk to him, but we don't want to talk to him. That's how it is. If you have a question for the doctor, you can head to our Morning News Facebook page and post your question there. We'll talk to him again tomorrow. Have a good day.